Stoffer sælges som sikre og effektive af psykiatere og medicinalfirmaer. Hvorfor ser vi så en drastisk stigning i rapporterede bivirkninger for forbrugerne? Hvad er det, psykiaterne ikke fortæller? Al medicin forårsager biologiske ændringer i menneskekroppen. Inden for traditionel medicin kalder man de tilsigtede effekter for virkninger. De, der ikke er det, kaldes bivirkninger. Ingen medicin er uden virkninger. Men når det gælder psykofarmaka, der har ømtålige hjernefunktioner som mål, kan alle virkninger, selv de tilsigtede, være farlige, uforudsigelige og nogle gange permanente.
All these medications that are apparently supposed to act as a magic pill, they're finding all of them have side effects that, could put the patient in harm's way just as well as it could help them.
Så hvad gør denne medicin? Og hvordan virker den? Man skulle kunne finde meget af denne information i indlægssedlen i medicinens indpakning. I denne indlægsseddel findes virkningsmåden, fabrikantens forklaring på, hvordan medicinen virker i kroppen. Tag for eksempel antibiotika. Medicin brugt i over 50 år for at behandle infektionssygdomme, såsom stivkrampe, tuberkulose og halsbetændelse. Virkningsmåden er velkendt. Antibiotika stopper bakteriernes celler og hæmmer således deres udbredelse eller dræber dem helt. Men ved psykofarmaka siger fabrikanterne på deres egne indlægssedler, at virkningsmåden er ukendt.
Most of the medications that are given to clients, whether they're SSRI medications or they're antipsychotics, a lot of the pharmacology of these medications, they don't even know how they work in the first place.
Men man har lagt mærke til, at der er én bivirkning ved psykofarmaka, der er fælles for alle.
Most medication and psychotropic medication I've noticed tends to flatten the things, so that while you're decreasing the depression, you're also decreasing the joy. And so you're minimizing what it means to be human in the service of avoiding dealing with a problem.
They can't connect to the world around them. They feel like there's no feeling, which is, you should have some feeling there.
All that's doing is really numbing them down, and they're not doing the work that they need to do to resolve that issue that's going on somewhere internally.
Men at dæmpe følelserne er ikke den eneste måde, hvorpå psykofarmaka påvirker brugeren. Hver af de 5 store klasser af psykofarmaka har deres egne bivirkninger. Typisk antipsykotisk medicin såsom taurin består af kraftige kemikalier, der oprindeligt blev udviklet til at blokere centralnervesystemet hos indlagte på psykiatriske hospitaler. De bruges nu hovedsageligt på personer med alvorlige psykiske problemer og kan forårsage følelser af hjælpeløshed, svækkelse af sindet, nerveskader, demens, muskeltrækninger og organskader, for at nævne nogle få. Angstdæmpende midler, såsom Valium og Xanax, ordineres mod nervøsitet, angst og paniksyndromer. De kan give patienterne dissociation, kognitiv svækkelse, øget aggression, udmattelse, hallucinationer og akut hukommelsestab.
They've got foggy thinking. They're bloated. They have weight gain. They're now diabetic. It's one symptom after another, all caused from the drugs that they're taking, and they don't realize it.
Stimulerende medicin, såsom Ritalin, Adderall og Concerta, bruges hovedsageligt for folk med såkaldte opmærksomhedsproblemer, for eksempel opmærksomhedsforstyrrelse, ADHD. Denne medicin er meget vanedannende og kan resultere i hæmmet vækst, vægttab, manisk adfærd, hjertebanken, nervøse trækninger, hjerterytmeforstyrrelser, alvorlig hjernesvind og hæmmet hjernefunktion, søvnløshed, voldelig opførsel og pludselig død. Ritalin, en stimulans, der ofte ordineres til børn, virker på kroppen i høj grad på samme måde som kokain, men er meget stærkere. Og nye studier viser, at det hos børn kan forårsage permanente skader på hjernens udvikling.
So you're going to have problems, and it is shown that some of these medications, particularly the stimulants that they're giving, like Ritalin, Concerta, all the ADHD medications actually shrink brain tissue.
They know that these psychiatric drugs destroy cells, destroy brain cells, shrink brain tissue. How can that possibly ever benefit anyone? It can't. That's the simplicity. It's not possible.
Antidepressiver er den fjerde type af psykofarmaka. Som navnet påpeger, bruges de ved behandling af depression og humørforstyrrelser. Bivirkningerne inkluderer sløret syn, tør mund, lavt blodtryk, interne blødninger, vægtforøgelse, søvnforstyrrelse, krampeanfald, hæmmet hjertefunktion og psykose.
The most common thing that I see is the sexual dysfunction. So women having a hard time reaching orgasm or just finding that their libido is lower. And I see that with men as well. And the second most common thing I see is weight gain. I have to say it is not terribly uncommon to see a 40-pound weight gain with antidepressants.
En undersøgelse fandt, at Paxil, et populært antidepressiv, syvdobler risikoen for brystkræft hos kvinder. Det mest risikofyldte er sikkert medicinering af gravide eller kvinder, der lige har født med antidepressiver.
When the mother takes the drugs, the psychiatric drugs, or any type of drug in that, like an antidepressant or an anti-anxiety or an antipsychotic drug, that's going to affect the baby as well as the mother, not just the mom, because the baby's going to get it straight through the umbilical cord, through the bloodstream.
Medicinering af gravide har ført til 20-30% risiko for tidlig fødsel, hjerneskade og ikke fuldt udviklede fostre ved fødslen. Og det tredobler næsten risikoen for alvorlige fødselsdefekter.
And the antidepressants have been shown to cause something called PPHN, which is a heart problem in newborns. And I think it's criminal to be giving medications to women knowing that their babies are going to be at risk.
When mom takes Paxil, she can have a baby born with sometimes they have the limbs are missing. It's called limb reduction. They can have cleft lip. They can have serious heart defects, missing chambers, or the arteries in the wrong place, and also can be born with the organs growing outside of the body.
Og disse er blot få af de mange bivirkninger fra psykofarmaka. For de 3 mest solgte antidepressive SSRI-midler er der 1.817 mulige bivirkninger for Prozac, 2.194 for Zoloft og 2.497 for Paxil. Interessant nok er der blandt bivirkningerne en forværring af de selv samme symptomer, som stofferne siges at behandle.
They cause depression. They cause suicidal tendencies and ideologies. So they cause a lot of the very exact symptoms that they're supposed to be correcting.
They're being treated for depression with a product that's going to create depression. They're treating for a psychosis with something that's actually going to create or has the potential of creating a psychosis.
Atypiske antipsykotika, en af de nyeste slags psykofarmaka, bruges for det meste til voksne og børn med diagnosen bipolar sindslidelse. De kendes også som humørstabiliserende midler. Selv om de blev lanceret med påstande om mirakelmedicin med meget få eller ingen bivirkninger, er det for nylig blevet påvist, at atypiske antipsykotika forårsager alvorlig vægtforøgelse, diabetes, hjertekransoversygdomme, akutte muskeltrækninger, pankreatitis og delirium. Selvom de nye antipsykotika oprindeligt blev godkendt udelukkende for behandling af skizofrene voksne, er antallet af recepter udskrevet til børn i de sidste 7 år blevet 5-doblet og skønnes at være 2,5 millioner recepter. Og denne medicinering skaber alvorlige konsekvenser.
You know, I've seen kids who have had significant weight gain on some of the antipsychotics, where they were pre-diabetic. You know, they've had changes in some of their cardiovascular functioning. So there are potentials to really damage the child's health.
When you get drugs that you're giving to kids that we know cause extreme weight gain and attack the liver, attack the kidney, that have long-term results, these children that we're giving them today, this medication, we may be doing, kidney dialysis for in 10-15 years.
Og det er ikke blot børn, der påvirkes. Det anslås, at psykofarmaka i USA er skyld i mere end 16.000 trafikulykker hvert år. Og den undersøgelse var kun for bilister over 65 år. Og hvad sker der, når disse uønskede bivirkninger dukker op? Almindeligvis vil psykiateren udskrive en recept på endnu en medicin.
It's called polypharmacy. It's just adding additional, if the first drug doesn't work, you add a second drug. If you have an adverse side effect from a drug, then you add another drug to deal with the adverse side effect.
And then let's say they start an antidepressant and now they can't sleep. So in order to counteract that, they'll be given a sleeping pill. Then a tolerance builds up. So they might now need another drug because they're now at a tolerance level of the first drug that it's no longer creating the, quote, expected or helpful result.
It's not uncommon to see people 5, 6, 8, 9, psychotropic drugs. And there's absolutely not a shred of research that supports that these drugs can be used safely and effectively in combination.
Tag for eksempel tardiv dyskinesi, en bevægelsesforstyrrelse, der udelukkende forårsages af psykofarmaka. Fra 50'erne og 20 år frem fortalte psykiaterne ikke patienter om sammenhængen mellem tardiv dyskinesi og antipsykotika, såsom Torsin og Haldol. Da psykiaterne endelig indrømmede sandheden om deres piller, var tusinder allerede permanent forkrøblede. Selv i dag har 73.000 ældre tardiv dyskinesi, og medicinrelateret Parkinson er påvist hos yderligere 61.000 mennesker. Men denne slags psykofarmaka er langt fra undtagelsen. Rapporter kommer nu for dagen om, at atypiske antipsykotika og antidepressiver såsom Zoloft for mange resulterer i tardiv dyskinesi, nogle gange blot måneder efter påbegyndt brug. Men psykiatere og medicinalfirmaer fortsætter med at afvise disse fældende beviser og skriver recepter på stofferne selv til børn. Men den frygteligste af alle de bivirkninger af psykofarmaka, der opleves af brugerne, er nok en intens indre uro og restløshed, kendt som akatesi.
These drugs can cause something called akathisia, which causes people to become very agitated, and actually a little nuts, a little off balance, and they'll do things that they never would have done before, things that are totally out of character.
This is a normal person without any history of auditory hallucinations, and all of a sudden they'll say there's voices telling them this is the only way to stop the pain, it's the only way is to kill themselves.
Had patients tell me that they never, ever, ever had one single thought about suicide in their entire life until they started on the drug.
Det anslås, at mellem 10 og 25% af brugerne af SSRI-antidepressiver, næsten 7 millioner i USA, har akatesi. Og selve psykiatriens diagnostiske og statistiske håndbog over mentale forstyrrelser indrømmer, at der er en forbindelse mellem psykofarmaka, akatesi og selvmord. Statistikkerne støtter dette. Selvmordshyppigheden blandt den almindelige befolkning er mindre end 11 ud af 100.000. Men for hver 100.000, der tager SSRI-præparater, ryger hyppigheden op til 718. Mere end 65 gange flere. Og alligevel bliver vi dagligt fortalt af psykiatere og medicinalfirmaer, at psykofarmaka faktisk forhindrer selvmord. Så hvad skal vi tro? Man kan begynde med medicinalfirmaernes egne advarselsbreve til lægerne, eller ikke publicerede data om antidepressive effekter, eller en analyse af Prozac ved at bruge FDA's egne statistikker, eller selv en rapport fra det britiske underhus om Cyprexa. Selvfølgelig er det ikke alle, der begår selvmord, men mængden af andre bivirkninger kan være skræmmende.
The medication that the psychiatrist prescribed me made me feel awful. Constant headaches, constant nausea, wanting my skin to turn inside out, just feeling like bugs were crawling all over me all the time.
It made me feel like all slow and like sluggish and stuff. And when somebody would ask me something, it would kind of like take a minute, like, what?
These drugs have affected my heart. They have affected my liver.
Weight gain one time, hit like 40 pounds.
These thoughts come over me like I wanted to kill I wanted to really hurt somebody.
It just sucks all the life out of you. So you're like a body, like a machine.
I didn't want to live. I didn't have the desire to live. I felt miserable.
You just can't live, you'd just rather die. Because there's no living when you're hallucinating every day.
I actually tried to commit suicide with my psych meds.
At some point when you realize that you are really just existing, you're not living, at some point you realize you need to take the risk to get off.
Men hvad med dem, der siger, at psykofarmaka fik dem til at få det bedre? At det for dem reddede deres liv? At fordelene overstiger ulemperne? er psykofarmaka faktisk sikre og effektive for dem.
So what ends up happening is that someone feels good for a while, and then very often they have to have their dose increased, and then they feel good for a while, and then they might have to have it increased again, or maybe they'll switch agents. So it's that kind of a story if you're not actually getting to the root of what's going on.
I think the research is pretty clear that then all of a sudden starts to change, and you start to have a supersensitivity to being depressed, in which case then they become more depressed, and then they're chronically depressed.
Og der er rigelige beviser for, at hvis psykofarmakas kortsigtede bivirkninger ikke får ram på dig, så vil de langsigtede gøre det.
Psychiatric drugs are toxic to the body. They do build up in the body and add to the body's reserve and reservoir of toxins that will suppress the immune system, and the body will try and fight them as foreign objects.
If they're on these medications for years and years and years, I mean, one of the things that we know about adults and some of the, for bipolar and schizophrenia is that they're dying at younger ages, and these are adults. So if we're starting this medication approach with young kids, what is their life expectancy going to be?
No one's really examined it or is looking at the big picture, which is what's it really do to a society with a proliferation of mood-altering, emotion-altering, or blunting in a society at large.
And I think we're going to really see a huge increase in violence and suicide and a lot of bizarre behaviors that we haven't seen, because for a very short period of time, only in the last 60 years, have we really started medicating, intoxicating our brains with these incredibly toxic substances.
Den meget klare risiko for betydelige lang- og kortsigtede bivirkninger burde få alle, der overvejer at tage psykofarmaka, til at tænke sig om en ekstra gang. Men hvad med dem, der allerede tager dem? Som uanset hvor hårdt de prøver, ikke kan holde op igen.